If progestins are given continuously, they keep the lining of the uterus from growing. Depending on how much levonorgestrel the particular IUD contains, this either stops period bleeding completely or makes it just super light. That is why hormone IUDs are also approved for and are frequently used nowadays as a treatment for women with severe cramping and severe period bleeding from various causes. Hello, welcome back to Gyno Info. And if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that any normal, everyday woman can understand without having to use a medical dictionary. In one of the previous episodes, we talked about copper IUDs. I explained what a copper IUD is, how they work, how effective they are, talked about risks and downsides of them, and also how quickly you can get pregnant after taking out your IUD. Today, we'll be talking about hormone IUDs. But first, I'm going to give you a very quick rerun on what copper IUDs are. For more complete information on copper IUDs, you just will have to listen to the episode that specifically talks about copper IUDs. So here's the recap. IUD stands for intrauterine device. Intra means inside in Latin, doctor speak. Uterus means womb in Latin. So intrauterine means inside the womb. The great majority of modern IUDs are all a small T-shaped piece of plastic put inside a woman's uterus to prevent pregnancy. Placing them inside a woman's womb takes less than 3 minutes and is done in a doctor's office. It does cause some cramping, but less than the cramping on the worst day of your period. Removing an IUD when the time comes usually takes less than 30 seconds. Copper IUDs have a thin copper wire wound around the stem of the T, while hormone IUDs have a sleeve around it containing levonorgestrel, which is, you guessed it, a hormone. We will discuss what that levonorgestrel hormone does later in this podcast. Complications with IUDs are extremely rare. They happen generally at the time when the IUDs are placed inside the uterus and can be mostly avoided by picking someone experienced to put in your IUD. Modern IUDs, whether they are copper or with hormones, are the most effective of reversible birth control methods because unlike a pill or a condom, you cannot forget to use them or to take them. They're already there inside your womb. Only 1 to 2 women out of 1,000 get pregnant if 1,000 women have regular sex for a year. IUDs, whether copper or hormone, are recommended by OBG professional organizations the world over for all women of all ages, whether they have already given birth or not. But again, for more details on copper IUDs, you have to check out the copper IUD episode. Let's now turn to the hormone IUDs. They're sometimes called intrauterine system IUSs by the pharma companies who make them. But calling them hormone IUDs is perfectly fine. That's what I call them. These types of IUDs have turned out to be a regular Swiss army knife for gynecologists. They can be used for so many things. First of all, of course, they prevent pregnancies. Then they work as a morning after contraception, just as the IUDs with copper do. But they can also be used as a cure for horrible periods with killer cramps and a blood bath every month. Then they work to treat precancerous changes in the uterine lining. Precancerous means something is pre, that is before cancer, but that can turn into cancer if not treated, and hormone IUDs can treat these precancerous lesions. And lastly, they can be used in hormone therapy for menopause symptoms. As a birth control method, hormone IUDs work similar to copper IUDs. They both hinder fertilization of the egg by making it hard for the sperms, the male seeds, to get to the eggs. And should a sperm manage to get to the egg and fertilize an egg after all, the IUDs work by preventing implantation, the beginning of the pregnancy. On the one hand, the progestin hormone, the levonorgestrel in the hormone IUDs, dries up the mucus inside the whole tract the sperm need to swim through, from the vagina, where they're released from the penis, through the cervix, that's the opening of the uterus that sticks down into the vagina, and then through the uterus up to the fallopian tubes, where the sperms will meet the egg. If the mucus along the path that the sperms are supposed to swim through is dry and sticky, then the sperms get stuck and never make it to the eggs. And so no fertilization can take place. On the other hand, they prevent a fertilized egg from settling down in the uterus and turning into a growing pregnancy. This is because the hormone in the IUDs dries out the uterine lining and keeps it from growing into a nice nest where the fertilized egg would want to grow. The eggs like a nice juicy lining to bed down in and implant, not a dry, tacky mucus covered thin lining. This blocking of implantation is the way both hormone IUDs and copper IUDs prevent pregnancies up to 7 days after unprotected sex. There are more studies on copper IUDs working as pregnancy protection after the fact, but both types of IUDs can be used. And both have the advantage over the morning after pills that you then have reliable birth control for many years to come until you decide to take the IUD out. It's just not a one-time shot like the morning after pill. The main difference to other birth control methods that use hormones and give hormones to the whole body is that with the hormone-releasing IUDs, only tiny amounts of hormones reach the rest of the body. They give their hormones off just inside the uterus. And unlike birth control pills, they do not reliably stop ovulation, egg production. Some women will continue to ovulate regularly, others only from time to time. But that's one of the reasons why you can get pregnant right away when you take the IUD out, because you have been continuing to ovulate all along. Now, let me explain this progestin hormone effect a bit further, as it is the way all the other extra benefits of hormone IUDs works. As I mentioned before, hormone IUDs have a sleeve full of a progestin called levonorgestrel, and that sits around the stem of the T of the IUD. Progestins are synthetic forms of the natural hormone progesterone. Levonorgestrel is just one of many synthetic progestins. It is the one used for all the different hormone IUDs. They just vary in the amount of levonorgestrel that they have in them. If progestins are given continuously, they keep the lining of the uterus from growing. Depending on how much levonorgestrel the particular IUD contains, this either stops period bleeding completely or makes it just super light. That is why hormone IUDs are also approved for and are frequently used nowadays as a treatment for women with severe cramping and severe period bleeding from various causes. Depending on the cause, they do not always completely stop the bleeding, but it always gets much lighter. In the past, many women would have been treated with a hysterectomy, surgery to take out their uterus. Now they have a less drastic choice. For more information on how to treat severe cramps and killer bleeding with your periods, please listen to or watch my podcast on the topic. The same mechanism of stopping the uterine lining from growing is also used for the treatment of endometrial hyperplasia and the prevention of endometrial cancer. Endometrium is the medical name for the lining of the uterus. Hyper means too much, and plasia means growth in doctor speak. So endometrial hyperplasia means too much growth, too much thickening of the endometrium, the lining of the uterus. The lining of the uterus is designed to grow and shed every month. It grows under the influence of estrogen, a hormone produced by the ovaries of all adult women before they reach menopause. Then the shedding of the lining is organized by progesterone, which is given off by the ovaries in the second part of a woman's cycle after ovulation. If for any number of possible reasons a woman does not have regular periods because she does not regularly ovulate and so doesn't make progesterone to guide the shedding of the lining every month, the lining will get thicker and thicker and thicker. It turns into endometrial hyperplasia. Then eventually, after a few months, she will bleed uncontrollably, several periods worth all at once. To stop this kind of major bloodbath generally needs medical help, often a visit to an operating room where the thickened lining has to be scraped out. Very often, a hormone IUD is placed right then and there in the operating room to keep this from happening again. But a woman with endometrial hyperplasia can also not bleed at all and just have some spotting once in a while. The lining then keeps growing and growing and growing and turning thicker and thicker and thicker, and weird so-called atypical mutant cells can develop inside this thick lining, which really is supposed to be discarded every month. But when it's not, then things can go astray. And after several years, these atypical mutant cells can turn into cancer, so-called endometrial cancer, cancer of the lining of the uterus. So if you don't have periods for several months, don't just think, oh, how nice, I don't need periods. Unless you're pregnant or are using a birth control method to deliberately stop your periods, which really is nice and about which you can learn more in my periods and cramps episodes. If your period doesn't come, you need to react now. You need to make an appointment with your doctor or nurse practitioners to find out why you're not having periods. It is generally some hormone problem, either with your ovaries, your thyroid, or it could also be caused by certain types of tumors or cysts in the ovaries. There are even certain brain tumors that can stop your periods. All can be treated, but first you need to figure out what is the problem, have a diagnosis. The way these hormone IUDs keep the lining of the uterus from growing is by giving off their progesterone directly inside the uterus. It is a local treatment only, with hardly any effect outside the uterus. The last thing gynecologists can use hormone IUDs for is as part of menopausal hormone therapy. You learned about that in the episode on perimenopause that I posted a little while ago. All women who treat their menopause symptoms with natural bioidentical estrogen, which among many other positive effects also makes the lining of the uterus grow, need to take some sort of progesterone to keep the uterine lining from growing too thick. They need to push back against the effect of the estrogen on the lining of the uterus was a progestin. One of the most convenient and effective ways that progestin can be given is with a hormone IUD. This gives off its progestin continuously, 365 days a year, directly to the lining of the uterus, which is where you want it, where it's needed. And only the tiniest amount will reach the rest of the body where you don't need it. So how long do hormone IUDs work? This depends on how much of the hormone is in your particular IUD and for what reason you are using it. If you are using it for birth control, then there are 4 different IUDs available. 2 of them are a little bit smaller in size and both have a fairly small dose of levonorgestrel, one less than the other. They are approved for either 3 or 5 years of birth control. Because of the low hormone dose, they both do not stop the ovaries from making an egg every month, from ovulating, and most women will have fairly regular but very light periods with them. Some women like them because they get kind of nervous when they're not bleeding regularly and prefer these type of IUDs. These slightly smaller hormones IUDs are sometimes also better for women who have not given birth yet because their womb tends to be a little bit smaller, and so putting in a smaller little T is more comfortable. The other 2 hormone IUDs contain both the same fairly large amount of levonorgestrel. This dose usually stops ovulation in most women and is also strong enough to shrink the lining of the uterus to the point where there is mostly no bleeding. They're both approved for birth control for up to 8 years, for control of heavy periods, and to prevent thickening of the lining of the uterus only for 5 years. And also for menopausal hormone therapy, they need to be changed every 5 years. After a certain number of years, how many years depends on the dose the hormones in the IUDs are used up. A sign that this is happening is that the periods start up again, or in the case of the 2 low-dose IUDs, the period begin to get much stronger. This happens gradually and not at the same speed in all women. Studies have shown that the hormones can last for at least a couple years after the expiration date in many women. For the purpose of birth control, they do not suddenly lose their effectiveness once the hormone in them is used up. Just their presence alone inside the uterus works as a contraceptive, and they become only slightly less effective than before the hormones were used up as far as birth control is concerned. Some older types of IUDs that are still used in some parts of the world don't contain any hormones at all and also no copper. They are really just a small piece of plastic inside the uterus and works by preventing implantation because a fertilized egg will not settle in a womb that is already occupied by an IUD. Depending on how soon you want to get pregnant again, you might want to keep your hormone IUD in for an extra year or 2 beyond the expiration date. If you want to get pregnant next year, there's really no need to remove it right now and pay for a new one, only to remove it in 10 months or 16 months from now. If, on the other hand, you already know that you do not want to get pregnant yet for several years, by all means replace your IUDs. And note that even though keeping your IUD in past the expiration date has been shown to be perfectly safe and effective, know that this is an off-label use. It is against what is written in the instructions in the package insert, even though we know it's safe and effective from many scientific studies. Off-label use is not covered by the liability insurance of the company who made the IUD. As I explained in the episode on copper IUDs, real complications with both types of IUDs Copper and hormone IUDs are extremely rare. They happen generally at the time when they are placed inside the uterus and can be mostly avoided by picking someone experienced to put in your IUDs. For more on these serious IUD complications, please listen or watch the podcast on copper IUDs. Also similar between both types of these modern IUDs is the chance that your body will not like having an IUD inside of the uterus and push it out. This is called IUD expulsion. The expected unwanted side effects, however, are very different for hormone and copper IUDs, unlike the serious complications. With copper IUDs, you're mostly dealing with extra heavy and extra painful but regular periods. Unwanted but expected unwanted side effects of hormone IUDs mainly have to do with irregular bleeding and spotting. With the two stronger hormone IUDs, at least half the women have no bleeding at all, especially after the first few months. For many people, that's the idea of having them. Those women are generally the happiest ones. The other half will have irregular, unpredictable light bleeding or spotting. Depending on how often this spotting occurs and how tolerant the women are, this will bother them a lot or hardly at all. Especially women who had the hormone IUDs put in because of horrendous bleeding and cramping find irregular spotting so much less bad than the alternative. Another bothersome but expected side effect can be skin problems, especially with the two stronger IUDs. Not only do hormone IUDs not help acne the way that regular birth control pills do, but they actually make skin worse in women with sensitive skin and can be a reason to switch back to the pill or to a copper IUD. Or you might want to try one of the smaller hormone IUDs that contain less hormone, which is easier on the skin. Or you can go on an acne treatment for the time you're using a hormone IUDs. These are all options, and I encourage you to discuss these options with your doctor or your skin doctor and then decide together with her what you want to do. Rarely, some women who are particularly sensitive to even the tiniest amounts of hormones reaching the rest of their body from the progestin that is mostly released just to the uterus will experience some bloating and some even will feel depressed. This is why it is a good idea for women who know that they are particularly sensitive to any external hormones to first see how they do with a progestin only pill, a pill that has the same hormones but as a pill, before they spend a lot of money on an expensive hormone IUD that they might not tolerate and have to take out again. If they do well on the mini pill, they will certainly be fine with the hormone IUD. The other option to try is to try the two smaller IUDs that give off much less hormones than the two big ones. They will also give you more predictable bleeding. One other rare, unpleasant side effect for the two bigger IUDs that sometimes a temporary but uncomfortable cyst can form in one of the ovaries. This happens when these IUDs do not completely suppress ovulation, and sometimes when the ovaries tries to ovulate, it only goes part way, and an egg grows inside a cyst in the normal way, but the cyst never pops open for the egg to jump out. Ovulation doesn't ever occur. Then the cyst keeps growing for a while, becomes painful, and then shrivels up again on its own without any treatment. But while it's growing and hasn't shriveled up yet, it can become quite painful. Now, let's say a few things about how long it takes to be able to get pregnant after removing a hormone IUD. It's about the same as with a copper IUD. Unlike with birth control pills, where it can take up to a year before ovulation starts up again, most women will start ovulating regularly as soon as the hormone IUD is removed. With the two smaller IUDs, they might never even have stopped ovulating in the first place. 8 out of 10 women will be pregnant 1 year after removing their hormone IUD, many already in the first 3 months. So this is about the same rate of pregnancy for women who never had an IUD at all, for couples who just decided to stop using condoms and go ahead and get pregnant. The failure rate for hormone IUDs, the chance of you getting pregnant despite having an IUD, is about the same for copper IUDs and for hormone IUDs. 1 to 2 women out of 1,000 per year get pregnant despite having an IUD. Then the IUD has to be removed immediately to avoid complication, even if you decide to continue the pregnancy. And of course, you will need to make sure right away where the pregnancy actually is. All IUDs only prevent pregnancy in the uterus. They are not able to do anything against ectopic pregnancies, pregnancies in the wrong place, such as in the tube. If ever you have a positive home pregnancy test, call your doctor or your clinic immediately. These are the most important points I wanted to teach you today. Modern IUDs are the most effective of reversible birth control methods because unlike a pill or a condom, you cannot forget to use them. They are already there. Only 1 in 2 women out of 1,000 will get pregnant if 1,000 women have sex regularly for a year. IUDs are extremely safe and carry only minimal risks. All IUDs are an excellent method of morning after contraception, and IUDs, whether copper or hormone, are recommended by OBGYN professional organizations all over the world for women of all ages, whether they have already given birth or not. Both can also be placed in the uterus immediately after birth and after abortion or after a miscarriage. And hormone IUDs can be used for things other than preventing pregnancy, for the treatment of severe and uncontrollable period bleeding and cramps, for the prevention of hyperplasia and cancer of the lining of the uterus, and also for menopausal hormone treatment. This brings us to the end of this episode. I know it was long, but I find these IUDs so important and so interesting that I think it's worth talking about them. I hope you liked it and it gave you a lot of information that is useful to you or your friends. And if you have any further questions about hormone IUDs or any other topic having to do with women's health, please don't hesitate to send them to me at questions@gynoinfo.net. And again, that's questions@gynoinfo.net. And if you like this episode, please give it a lot of likes and share it around. It would also be super nice if you would subscribe to Gyno Info. It helps Josh and me to keep this podcast going. Thank you, and until next time, goodbye. Until next time, thank you for listening, and remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at GynoInfo and on LinkedIn at Gyno Info Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.